University School of Dentistry, where he spent 3 years becoming certified in advanced periodontics and implant surgery. Dr. Kim is an internationally published author, speaker, and mentor on periodontics and implants. Dr. Kim, welcome to the show.
Thank you very much for inviting me.
I invited you today. I come across rarely a doctor who completely impresses me, and so I want to talk to you about implants and periodontics. But before we do that, tell me a little about yourself and why you chose Orange County.
I chose Orange County because it's the area I want to live and raise my kids, and it's a nice environment, nice area to live with the family.
Nice people?
Yeah, nice people.
Like everybody?
I love it.
Okay.
So
now I know that you were
Mhm.
a general dentist.
Right.
I know you spent, from talking to you before, you spent 6, 7 years being a general dentist,
Mhm.
and you decided to go back to school to specialize in periodontics, and I know that you travel all over the world learning what you can. Why would you give up a very successful general practice to specialize?
When I started out practice, I was lucky enough to have mentors who's been specialists in implant dentistry, and I learned from them. I started implant dentistry with my general practice, and after 7 years of practice afterwards, I found that there's a limitation that I could reach for the patient, because there are certain things that I cannot achieve.
So as a general dentist, you realized you were hitting a wall as to what service
yes.
you could provide your patients.
For patients, yes.
Tell me a little about gum disease. What causes it? How do you treat it? You know, I told you when I was young, growing up, my mom used to say if my gums bled, it was because I brushed my teeth really good and maybe brushed them a little too hard, and so you get a little blood. And you told me that's not true. If my gums bleed at all, it's usually the first sign that there's something going wrong.
Yes, so usually signs of periodontal disease is whether you notice the bad, suddenly sometimes you're starting to have bad breath in your mouth, or your spouse is telling you that you're having bad breath, or sometimes you see the swellings around the gums and bleedings, and even without just brushing, and if you touch, you bleed. And sometimes you feel that when you wake up, suddenly you feel that your bites are not normal. You feel that your bites are changed and your teeth migrate a little bit here and there.
What about like a funny taste in your mouth? Can that mean?
Yeah, probably, yes.
Okay.
That's also the part of the symptoms. So if you have those symptoms, you may ask your general dentist or hygienist to see if they can refer you out to periodontist to check them out.
All right. What are some of the treatments, and what are some of the bad things that can happen if you don't take care of your gums?
Periodontal disease has certain stages, and it starts with what we call, probably you may heard about gingivitis, which is inflammation of the gums. It doesn't affect the bone at the stages. If you're living like that for a long period of time, enough time, it progresses to periodontal disease, which is basically destructive disease, which destruct the bones around the tooth.
Can it make the bone recede?
Recede, and that's why you notice sometimes if you have periodontal disease, you notice that your gums been receding over a period of time.
Right.
And suddenly you look at the mirror and you look at, wow, gums been receded. So it's a good sign that you're losing your bone support around the tissue, around the teeth.
Okay.
So that's the time maybe you want to check with your
You made a
dentist.
comment to me earlier. We talked about people who have gone to their dentist every 6 months, got their cleanings, got their gums checked, and they start having problems. You were talking to me, why would I want to go straight to a periodontist to get my gums checked? Is there an age I need to do that? Is there a reason? Even if I'm seeing my family dentist, should I go maybe once every couple years to have somebody? Is there stuff that maybe the regular dentist misses because he does it that you would find? What would be the reason?
All the dentists are trying to help their patients, but the thing is they're doing a lot of stuff. I mean, their office is not only gum treatment, but also a lot of fillings, orthodontics, and other side of the treatment. And so their focus is not only on those one side, gums, right? So they may tell you you're fine in 6 months, but the thing is, if you look at periodontics, is based on information. Periodontics. We're based on, we call it probing depth. We probe around the tooth, and we get the measurement every time when patient walks into our door. And through that, all this examination, through all this data, we came to the conclusion whether patient has periodontal disease or not. But most of the general dentist office, unfortunately, even hygienist doesn't have time to probe each patient's full dentition.
Because they're doing all kinds of other
all
things.
kinds of other things, and so they're back in time, so they're missing all this information. So sometimes they are just busy cleaning out the patient's teeth. Cleaning is not the only solution sometimes, actually most of the time. So you have to see what has changed in patient's mouth over a period of time, not only 6-month period of time. Maybe 6-month period of time you don't see much of differences, but when you compare within a year or 2 year, 3 year,
you start to see the differences.
You start to see the differences.
Okay.
That's the time.
I know you brought some photos. I want to look at them a little bit because I want people to realize that there are options when they come to the gum. The first one we're going to look at is a photo of what?
Oh, which is periodontal. Part of the periodontal plastic surgery is one division from periodontics.
Okay.
And these days, a lot of people are talking about aesthetics. And this procedure has been started out as a functional because patients feel sensitivity.
Now this is where the gums have receded back down off the teeth a little bit. Okay.
Yes, and patient feels sensitivity on the tooth, and also the teeth are losing their support from the gums.
All right.
And also the
okay. I see. All right, we're looking at the picture here. I notice you can see the dents in the teeth. Is that normally where the gum would come up to?
Yes, there's a dent. Yeah, you can see that the ridges.
And you can see there. Now, is that exposed part of the tooth a little bit more sensitive?
Very sensitive for some patients.
All right. What would you do for this person?
Well, there are options that we could do grafting. We call it grafting, gingival grafting. So we harvest. We take the grafts from the patient's own palate, or there are other materials we can get it from the other source.
Okay, and you graft it in.
Graft it in.
All right, let's take a look at the after and see the difference.
So you can see the with
wow,
the
that's
graft.
Incredible.
Yes, this picture is after 1 month, and patient has.
That's after 1 month.
After 1 month.
All right, and now that'll help with the sensitivity. That'll help keep the teeth.
Right.
Okay.
Usually in general dentistry, they try to cover with the tooth-colored material, which is composite.
Right.
And sometimes
you
give more. Yeah.
You're masking the problem versus taking care of it. All right, let's look at the next one. So this is the young girl that has what? Her teeth look too small.
This is what you call it delayed passive eruption. This patient, when they grow up and teeth are emerging to their mouth, what happens is that gum has to be receded where it's supposed to be. Otherwise, I mean, as you see, it shows the short crown.
Traditionally, she would go get veneers and it would lengthen the teeth.
Right.
And that really wouldn't deal with the problem.
Right.
It would be masking the problem. So what happened to this girl? What did she have done?
She has done what they call it periodontal plastic crown lengthening.
Let's look at the afterwards.
Yeah.
The gums on this, she's had them sculpted back so that it lengthens. It doesn't really lengthen the tooth, it just exposes more. So it looks like she went and had veneers done almost.
Right.
But this is a natural fix to that gum will stay there. Anyway, I want to look at your next one real quick, and then we have to take a break. This gentleman came in to you, and his teeth were, well, let's look at his mouth open.
Yes. He wants to take care of these two front teeth, and his wife was complaining, actually. That's the reason he came in, and smells bad, and all these teeth were wiggling. So he didn't notice from the beginning, but over a period of time, he noticed that, I mean, this teeth is falling apart.
So he comes to you. You send him to have the teeth straightened by an orthodontist, or what do you do?
No, actually, this patient has referred from prosthodontist, which is, specially trained general dentist, you can call him. Actually, prosthodontists want me to fix his problem, actually, but patients didn't want the implant treatment.
All right. So what did they pull the teeth?
Yeah, they pull the teeth, and the patient comes in like this and prep the tooth. So what I did was
ground down the other ones.
Yeah. So
now, when he left them, they put this temporary.
Temporary, yes.
Okay, with that space up above it.
Right. There is a deficiencies in the ridge. Not only front and back, also as you can see, width of the bone is not enough. Height of the bone is not enough. So I had to build the bone where it's supposed to be based on what prosthodontist wants and what patients want.
You did the surgery, you built the bone back up, and then now that's what it looks like. Now, will it stay like that?
Yes, it'll stay like that, and it's a combination procedure. We did the hard tissue bone graft and together with the soft tissue graft. So it'll stabilize.
Then he puts the bridge in.
Yes.
And that's what he looks like now.
Yes, it's a pretty nice smile.
It's a beautiful smile. All right, we have to take a quick break. When we come back, we're going to go a little bit more about perioplastic and what it is, and I want to get into with implants and what you can do in stabilizing dentures. You've been watching Medical News Network. I'm Mike Wiggenstein. We'll be right back.